Last week, guys, we talked about hyperventilating, and this week we're going to be talking about panic attacks. And don't forget to hit that subscribe button and also hit the notification bell so you don't miss out on any of our weekly videos. Now, panic attacks or panic disorder is an anxiety disorder where you regularly have sudden attacks of panic or fear. Everyone in some time of life experiences feelings of anxiety and panic at certain times. It's a natural response to stressful or dangerous situations. But someone with panic disorder has feelings of anxiety, stress, and panic regularly and at any time, and often with no apparent reason. So what is anxiety? Well, anxiety is a feeling of unease, and it can range from mild to severe and can include feelings of worry and fear. Panic is the most severe form of anxiety. You may start to avoid certain situations because you're fearful or you fear they're going to trigger another attack. This can create a cycle of living in fear of fear, and it can add to the sense of panic and may cause you to have more attacks. Now, during a panic attack, you get a rush of intense mental and physical symptoms, and it can come on very quickly and for no apparent reason. A panic attack can be very frightening, and it can also be very distressing. And symptoms can include a racing heartbeat, feeling faint, dizzy, sweating, clammy, nauseous, chest pain, shortness of breath, trembling, hot flushes, chills even, shaky limbs, and sometimes even a choking sensation and dizziness, and there might be numbness or pins and needles, especially in the extremities. The mouth can also feel quite dry, and there may be a need to go to the toilet. You might also hear there's a ringing in your ears, and there might also be a feeling of dread or fear of dying. It can also sometimes be described as you're not being connected to your body. Most panic attacks can last between 5 and 20 minutes, but some have been reported to last for up to an hour. The number of attacks you have will just depend on how serious your condition is. Some people have attacks once or twice a month, while others may have them several times a week. Although panic attacks are frightening, they're not dangerous. An attack will not cause you any physical harm, and it's unlikely you're going to be admitted to hospital if you're having one. Be aware though that most of these symptoms can also be symptoms of other conditions or problems, so you may not always be having a panic attack, and that's why it is important to call the emergency medical services if you're in doubt. I would always encourage you to speak to a GP if you've been experiencing symptoms of panic disorder, because they'll ask you to describe your symptoms, how often you get them, and also how long you've had them for. They may also carry out a physical examination just to rule out any other conditions that may be causing these symptoms. It can, of course, always be difficult to talk about your feelings and emotions and personal life, but try not to feel anxious or embarrassed by it. It is important to discuss them with your GP. You may be diagnosed with panic disorder if you have regular and unexpected panic attacks, followed by at least a month of continuous worry or concern about actually having further attacks. Treatment aims to reduce the number of panic attacks that you have and to ease your symptoms. Talking therapies and medicine are the main treatments for your panic disorder, but your treatment will just depend on your symptoms. If you go down the talking therapy route, you can refer yourself directly to a talking therapy service for treatment based on CBT, cognitive behavioural therapy. Now, this will be different in the country where you're watching this from, but I would always suggest you go to the GP and see if they can refer you to a CBT specialist. The therapist will hopefully give you the tools and be able to teach you ways of changing your behaviour to help you keep calm during an attack. You may also need to see your GP regularly while you're having CBT so they can assess your progress. The other route you can go down is medicine. Because if you and your doctor think it might be helpful, you may be prescribed a type of antidepressant. Now, antidepressants can take 2 to 4 weeks before they start to work, and up to 8 weeks to work fully. And keep taking your medicines even if you feel they're not working. And only stop taking them if your GP advises you to do so. So there are things you can do. There's lots of resources out there on the internet right now where you can research CBT. You could also try complementary therapies such as massage, aromatherapy, Pilates, yoga, all these things to help you relax. You can learn breathing techniques to help ease your symptoms. You can do regular physical exercise to reduce the stress and the tension. And avoiding sugary foods and foods high in caffeine and alcohol, and stop smoking, as they can all make your attacks worse, so do try and cut back on those. And when you're having an attack, it's really important to try and remember to stay calm. And remember they're not life-threatening. Try and stay where you are and just breathe through it. Now that might seem easier said than done, but I would always seek medical advice if you're ever worried or concerned about your panic attack disorders. Have a conversation with your GP. Refer yourself to a therapist if you can. Research it on the internet. There are lots of things out there for you to have a look at. If you start to hyperventilate, look back on that hyperventilation video. I'll leave the link here for you. It gives you ideas of how to calm your hyperventilating down. Thanks for listening, guys. Stay safe and stay well.